But if I told you that by knowing just these 15 suffixes in this video, you will be able to unlock the meaning of over 500 medical terms. And by the end of this video, we will have a quiz where you will be able to test your knowledge and actually see how many medical terms are you able to understand now, knowing just 15 suffixes. So let's get started. I'm Dr. Shaima, and we're going to build your medical vocabulary today from the ground up. So if you don't know what suffix is, basically a medical word is not just one word like in English. It could be structured like a Lego. So it has a prefix, which is something that is in the beginning of the word, and then we have the root word in the middle, and then we have something called suffix that comes in the end of the word. So today we're going to discuss 3 groups of medical suffixes that are very common, and you will be able to understand a lot of medical terms by knowing these suffixes. The first group is what's wrong suffixes. So what does this mean? These suffixes are present in the end of the word when we are trying to express something going on in an organ or a body part. For example, we have a very, very common suffix, which I call the king of suffixes. That is the suffix iris. Iris. It comes at the end of the word. So it means inflammation, or sometimes it can be also used to express infection. So iris, it starts with an I, it means inflammation. So whenever I see iris at the end of the word, I understand that this organ, even if I don't know what organ this is now, or if I don't know what body part is this, but I understand now that there is a process of inflammation going on. Inflammation means swelling and edema in this organ. Like, let's take some examples. If we say gastritis, this means inflammation of the stomach. And don't worry now if you don't understand or you don't know the root words themselves, just focus on that suffix, okay? And you will be able to acquire a lot of the terms as we go on and take more examples. So if we want to say inflammation of the liver, we would say hepatitis. Hepatitis. So itis is an inflammation. If we want to say inflammation in the joints, we would say arthritis. Arthritis, okay? So that's the first one. The second one, what's wrong suffixes is osis. That comes in the end of the word, osis. So whenever we see osis, this means there is an abnormal condition happening in this organ or this body part. If, for example, we want to say there's a abnormal skin condition, we would say dermatosis. Dermatosis. If we want to say there's an abnormal kidney condition, we would say nephrosis. Nephrosis. So nephr is the kidney. So nephrosis is an abnormal condition in the kidney. So osis, abnormal condition. Third one is pathy. Pathy. If you know the word pathology, which means the signs of diseases. So pathy is a disease. A disease. If we want to say that there is a disease in an organ, we would say cardiopathy, for example. There is a disease in the heart. If we want to say there's a disease in the kidney, how we would say it? Just give you a second to think. Exactly. Nephropathy. Nephropathy. So this is a disease in the kidney. If we want to say there's a disease in the nerve, we would say neuropathy. Neuropathy. So pathy is a pathology, is a disease. The fourth one that's easy to remember, which is megaly. So mega means giant. It's a huge, it's enlarged thing. So whenever we want to say that this organ is enlarged or it is bigger than normal in size, we will add the suffix megaly in the end. So hepatomegaly is an enlarged size level. Cardiomegaly is an enlarged heart, okay? This one, which could be tricky sometimes, and I need you to understand this because sometimes it is confused for something else. The suffix oma, O-M-A, at the end of the word, means tumor or a mass, okay? So it does not mean cancer specifically. It means tumor. So what's the difference between a tumor and a cancer? Tumor is a mass. It's abnormal growth and proliferation of tissues, but it could be benign or it could be cancer. So it doesn't necessarily need to be cancer. It could be benign or malignant. It could be something that is okay, not to worry about, benign, or malignant that is cancerous and that sends other cancer to other body parts, and that could potentially lead to the person die, for example, if he was not receiving treatment. But tumor in general could be benign or malignant. So whenever we say ulna, this doesn't mean cancer, it just means tumor. And this tumor could be benign or malignant. For example, if we say lipoma, so there's a tumor of the fatty tissue, fatty tumor. If we say carcinoma, it's very similar to the word cancer. So this is a cancerous tumor, okay? So remember, oma just means tumor, it could be benign or malignant. The second group of suffixes, congratulations if you made it so far. The second group, we have the fix-it suffixes. So what does this mean? Whenever someone does a surgery or procedure, we use these suffixes to express how the surgery is being done. For example, if someone gets his appendix removed, okay, there's a term that is used to express the removal of something. If someone gets an opening or a hole made in an organ or a body part, there is another suffix that is being used to express that. So the first one, which is very common, we will find it very often, that is ectomy. So what does ectomy mean? Ectomy means excision. If you know what excision means in English, so it's like remove. You're entirely removing something. So if someone gets his appendix removed, that is appendectomy. Okay. Someone gets his tonsils removed, that is tonsillectomy. So now you know that ectomy is the removal, is an excision, surgical removal of the organ. The second one is otomy. So we have ectomy, that is excision, removal. Otomy, it's incision. So what's the difference between excision and incision? Excision, it's a removal, as we said. Incision, it's making, cutting into something. Like if, for example, a doctor wants to open the abdomen, okay? But not like in a surgical way where he has a scalpel and he opens it. No, he just wants to cut into the abdomen, make an incision into the abdomen. That is called otomy. For example, that is called laparotomy, cutting into the abdomen, okay? There is something else that could be confused with this otomy suffix, which is called stomy. Stomy. So stomy is an opening. Like, for example, some people have openings being made into their colon. Okay, for, something maybe we won't discuss in this video, but I'll just give you an example. If someone for any reason removed a part of his colon, maybe he have cancer or anything in this part. So now he has no way of the stool exiting through his body. So what they do is that they redirect the lower end of the colon, and instead of being directed to the anus, they are redirecting it to the abdominal wall. And there's a bag externally that collects stool until this patient is able to regain his colon function and is able to pass the stool normally. So this opening creation is called ostomy, stomy, okay? We have colostomy, opening in the colon. So otomy is an incision, but ostomy is an opening being created. The next one, we have plasty. I think also this one is easy to remember because we are surrounded by plastic surgery and all of these things. So plastic is similar to like plastic surgery when someone gets something repaired. Like if someone had a repair in his nose, that is called rhinoplasty. If someone had a repair being done to his blood vessels, for example, that is called angioplasty. Again, don't really worry about the root words. For now, just focus on the suffixes. So plasty is a surgical repair. The last one in the fix-it suffixes, we have scopy. Scopy, it refers to visual examination. We want to look at something. For example, endoscopy. We want to look inside of something. Inside, endoscopy. When someone has an endoscope, that means we want to visually look at the inside of him by using this instrument that is called endoscope. Okay. If we want to visually see the colon from the inside, we would use an instrument called colonoscope. The process itself is called colonoscopy. Okay, so scopy is for visual examination. Now for the final group of suffixes. And after this group, there will be a short quiz. So make sure to stick till the end to be able to assess your knowledge and how much were you able to pick up. These symptoms and measurements. So there are certain suffixes that are being used when we want to express a feeling or a symptom. For example, if someone is having a pain, okay, that is a suffix called algia. Algia. For example, if someone is having a pain in the muscle, that is called myalgia. Okay, let me ask you a question. If someone has a pain in his nerve, okay, based on what we said so far, what is a nerve? What is a nerve in medical terminology? So it's in neuro. So we have neuralgia, and a pain in the nerve. Okay, so that's the first one. We have anemia. Anemia is very common. It's a blood condition, and it will be in so many medical terms. For example, when we have a patient having anemia, that he has low blood. Okay, so he had like low hemoglobin level. If we say calcemia, what does this mean? Exactly, calcium in the blood. If we say, for example, uremia, okay, and so on. So the next one is another liquid in our body, which is urine. If, for example, we want to say there is a condition when there is a symptom related to the urine. For example, if we want to say that this person has difficulty in urination, or painful urination, we would say dysuria, okay? So uria is a urine condition. This is a difficulty. This is a prefix, okay? We will take it in another video. But the suffix is uria, which is a painful, which is a urine condition. If you want to say there is a blood in the urine, we would say hematuria, for example, okay? Okay, next one we have gram. Gram is also a very common one. For example, when we say that this person had a mammogram, okay, now he had a record or a picture of something, okay? So gram is a recording or a picture of something. So mammogram is, it's basically an imaging technique for the breast. So it's a picture of the breast. When we say electrocardiogram, don't worry about the first part of the term as we have agreed. So there is a recording or a picture of what? Cardio, heart, electricity. Yes, exactly. So it's a picture that shows the electricity of the heart, electrocardiogram, okay? So gram is a picture or recording. The final and the last one is logist, okay? And this is also an easy one to remember. If we say dermatologist, that is the specialist who specializes in dermatology. If we say someone who specializes in the nervous system, that would be a neurologist, right? Someone specializing in the heart condition, that would be cardiologist, okay? I hope. Now, just a quick revision before the quiz. We have the ectomy, it means removal, surgical removal. We have otomy, it means doing incision or cutting into something. We have ostomy, that is to create an opening, like colostomy. We have plasty, which is to repair something surgically, like rhinoplasty or angioplasty. We have scopy, that is to look visually at something, colonoscopy, endoscopy, okay? So now we have algia. When someone is having pain in his muscle, you would say myalgia. Pain in the nerve, you would say neuralgia. When we have a condition in the blood, that is emia, a blood sugar or sugar in the blood, glycemia. Calcium in the blood, calcemia. When we have a urine condition, that is urea, like dysuria or hematuria. When we want to take a picture or a recording of something, that is gram, like mammogram or electrocardiogram. The doctor specializing in something, that is logist, dermatologist, or neurologist. And the last part we have is when we want to express an inflammation, that is itis, like hepatitis, inflammation of the liver, or arthritis, inflammation of the joints. When we have an abnormal condition, that is called osis, like dermatosis or nephrosis, abnormal kidney condition. When we have a disease or a pathology, that is pathy, like cardiopathy or neuropathy. When we have an enlarged sized organ, that is megaly, like hepatomegaly or cardiomegaly. And last, when we have oma, and as a suffix, that means there's a tumor or a mass. For example, lipoma or carcinoma. If each surgeon performs a procedure to create a permanent opening in the colon, a permanent opening, remember, is it stomy or ectomy or otomy or plasty? Yes, if you get it right, you're absolutely excellent, because this is a confusing one. We have the stomy, okay? Remember, otomy is just an incision and cutting into something. But ostomy is a permanent opening. So next question, we have which medical term to describe a surgical repair or reconstruction? Yes, plasty, like rhinoplasty. Next one, patient suffering from myalgia. What does this mean? Does he have a muscle tumor or an inflammation of the muscle or a pain or enlargement? Yes, exactly, muscle pain. So what if the patient has a tumor in the muscle? How we would say it, we would say myoma, right? If he had an inflammation, that would be actually myositis, okay? It's kind of different. Identifies hepatomegaly. What does this mean? Does this mean that the liver is enlarged, or is it inflamed, or there's a fatty tumor, or there's just a liver disease of unknown origin? Yes, a liver is enlarged. Okay, correct. Which suffix to indicate a condition related to the presence of a substance in a urine? Exactly, urea. That's very obvious. Next one, the difference between laparotomy and laparoscopy. I'll give you a second to think. Exactly. The last one was if cutting into, and the other is visual examination, laparoscopy. Next one, if a patient has a lipoma, what does this mean? Yes, it is a tumor of growth made of fat. Next one, which describes the role of a dermatologist. It's an easy one. Someone who specializes in the skin. The last and final question, patient having an ECG, electrocardiogram. What does this mean? Yes, exactly. Recording or a picture of the heart's activity. I hope you're able to catch a lot of the terms by practicing this with us. And thank you very much. See you in the next video. Let me know in the comments if there's a specific topic that you want to be covered in the next videos. Thank you and have a good day.